Well, now that at-home COVID tests have become more commonplace, case numbers in the U.S. are likely much higher than what's being reported. Let's bring in our chief health editor, Dr. Partha Nandi now. Dr. Nandi, is there any idea then just how high the numbers are, how much higher they actually are?
Yeah, that's a good question. And home tests are making it easy and convenient, Brian, so you don't have to wait so long for COVID results, right? But the downside is this, that people don't have to report either positive or negative results. And there are now more COVID-19 tests being performed in non-traditional settings, right, compared to laboratories. So it's no surprise that cases are being undercounted. Experts at the Institute for Health Metrics and Evaluation estimates that only 7% of positive cases in the U.S. are likely being detected, small number. And the true number of COVID-19 cases are actually 14.5 times higher. I find this a bit concerning, I'm sure you do too, because people are used to looking at case numbers to see how much COVID is prevalent in their community, and they might let their guard down if the numbers are low.
So if the test counts are unreliable then, Doc, is there a wisdom to the argument, well, then why are we keeping track at all if it's not going to be accurate?
Yeah, it's like, let's just throw it out, right? Testing, Brian, may not be a reliable metric like it has been in the past, but it's still helpful in my opinion. Why? Because rising case numbers can indicate there's a surge that's about to happen. That gives health officials time to act. For example, when case numbers started going up in Philadelphia, officials brought back indoor mask mandates. I'd also like to mention that there are other metrics that are being tracked, like hospital admissions and virus levels in wastewater. These are also good indicators of how much virus is spreading. What's important here is this, and if you test at home, be sure to submit results to the manufacturer. That's usually done via an app that comes with the test. Manufacturers are required by the FDA to report test results. Also take a test even if you think you have a cold. Really important there. There are people who have COVID but don't know it. There's also another reason why case numbers are lower and why our numbers are also ticking up. So bottom line is be aware that case numbers are being underreported. And when you see cases going up in your community, do take pandemic precautions. It's not over yet. Like what? Wearing a mask, washing hands often, and physically distancing when you can. This will help you to avoid getting infected.
With those at-home tests, report it whether it's a positive or a negative test?
Especially if it's a positive, but I would do both. Okay. Because then you have an accurate number of what's going on.
Dr. Nandi, grateful as always for your time. Thank you.
My pleasure.